Dr. John, I've recently had a lot of questions from clients about growth plate fractures. Can you share with us, please, what is the growth plate?
The growth plate is the area of the body where our bones actually grow. And usually, what happens is when we're children, those growth plates allow long bones to increase in length and then also allow the axial skeleton or the spine to also increase in height.
What's the long bone?
So long bones, examples of long bones include your thigh bone or femur, your tibia or your shin bone, or your humerus or upper arm bone. Those long bones are typically where we see a lot of growth in children during their development.
When you say during their development, generally, is there a time frame for when children are finished with their development?
Sure, it differs by sex. Males typically will stop growing around 18 to 21 years of age, but it also, in females, it will stop around 16 years of age. But it can also vary depending on which bone you're talking about. Some bones, for example, the clavicle can continue to grow even up to early adulthood.
Do you have any visual aids that could help us to understand the growth plate?
Yeah, let's take a look at this first visual aid, and that will help us to understand the growth plate. So before we talk about the growth plate itself, we need to understand some of the anatomy of a long bone. Right adjacent to the joint is something called the epiphysis. That's the bone that's right next to the joint where the movement occurs. And then adjacent to the epiphysis is where the growth plate itself is. Just above that or below that, depending on the location of the growth plate, will be something called the metaphysis. And then the long part of the bone, where we think about a chicken bone, the long part of that bone is then called the diaphysis. So when we think about growth plates themselves, between the epiphysis and the metaphysis, the growth plate itself is made up of cartilage cells. And those cartilage cells kind of stack up on each other as they multiply, and that's what contributes to the growth. When the cartilage cells reach a certain level or height, they then become what's called ossified, or they turn into bone. The bottom part of those cartilage stacks will continue to multiply until there's a signal sent by the body to stop growing.
And the cartilage you were referring to, that's that green section between the epiphysis and the metaphysis?
That's right. That's right. And so, although the names of those layers aren't important, the germinal part, or the part where the cartilage cells multiply, is really important for continuing to add growth to a bone.
Just if I'm understanding you correctly, in that green section between the epiphysis and the metaphysis, that's the section that grows and expands during the formative years for children.
That's right. That's right. That's a good way to explain it.
Okay. I've had a number of clients recently, Dr. John, who have come to me explaining that they suffer growth plate fractures. Is that significant?
Growth plate fractures are significant for two reasons. First, a fracture involves the bone, so any bone fracture is damage to the bone itself. But in growth plate fractures, there's not only fracture to the bone, but there's also injury to the growth plate. And when you have injury to the growth plate, if it's significant enough, it can affect growth itself.
In what way does it affect growth, Dr. John?
If the injury involves the multiplying cartilage cells, if those somehow are injured where they don't multiply anymore, it can actually stop growth. Or if the cartilage cells are injured in a partial way, in other words, one side of the growth plate is injured more than the other, then that can cause a deformity where one side grows, but the other side doesn't.
Are there different scales and levels of growth plate fractures?
Yeah, I think that what would be helpful to look at is this diagram here, which classifies growth plate fractures from number 1 to number 5. This has also been called the Salter-Harris classification, named after the surgeons who identified it. If we look at this classification itself, type 1 is a fracture right through the growth plate. Typically, those ones actually have the best chance for healing because it's kind of a clean type of fracture and the cartilage cells aren't damaged as much. Type 2 fractures actually extend through the metaphysis. That's the part that's furthest away from the joint. Type 3 fractures extend through the epiphysis. These are starting to get more severe because they involve the joint. And when the joint is involved, you can actually develop, there's a higher risk for developing arthritis if that's not anatomically placed. The type 4 fractures extend through both the metaphysis and the epiphysis. So now you've kind of doubled the number of fractures that have occurred through the bone itself. And then type 5 is actually pretty severe because you've actually sustained a compression or crush of the growth plate where the chances for survival of those cartilage cells is a lot less.
Dr. John, when we have a number of clients who've suffered growth plate fractures, are there options available for them to seek out treatment so they can fix the growth plate fractures?
Yes, the options for treatment really are dependent on the type of fracture they sustain. And this is, again, where this Salter-Harris classification can be useful. If the fracture involves, let's say, just a type 1 fracture through the growth plate itself, oftentimes those can be treated with just a cast. But as the growth plate fractures get more severe, the surgeon will want to get more perfect placement of those fracture pieces, similar to how you put a puzzle piece together. And the surgeons actually have as tools, they can put screws and different types of pins in place to put those pieces back together.
Dr. John, do you have any visual aids to help explain what a type of a fix to a growth plate fracture might be?
So let's take a look at a diagram of an X-ray. And this particular X-ray is of an ankle. And in this ankle, you can see that the growth plate is kind of running horizontally and the fracture is running more vertically. This fracture would be classified as a type 4 fracture because it went through the metaphysis and the epiphysis into the joint. And because it traveled into the joint and it has some displacement, the surgeon wants to get really good anatomic fixation to try and give the best chance for restoring the joint and for fixing the growth plate. And so the X-ray that's next to the one where the fracture occurred shows screws in place where the screws have put the pieces back together like a jigsaw puzzle.
Who are the right type of medical providers to treat our clients who have suffered growth plate fractures?
Growth plate fractures are best treated by orthopedic surgeons. And the more complex ones typically will want to have seen by pediatric orthopedic surgeons who have gone through extra training to treat these kinds of injuries.
Dr. John, for those clients of ours who've suffered growth plate fractures, what does the future hold for them? What's their reasonably anticipated outcome?
Well, the spectrum of outcomes really depends, again, on the severity of the injury. In those least severe growth plate injuries, we can expect really no complications, no sequelae from the injury. But in those fractures that have either partial injury to all those cartilage cells that are contributing to growth, or a full injury to those cartilage cells, then you can either have deformity or you can have growth arrest.
You use two terms. I want to make sure that we understand them. Use the term sequelae and arrest. Let's talk first about sequelae. What do you mean by sequelae?
Sequelae are kind of the results that happen after an injury. So sometimes if people do have growth arrest or growth stoppage, then they can actually have an inequality in their legs or in their body parts. And if that happens, especially if it happens in the lower extremity, there are different measures to try and address leg length discrepancies or leg length inequalities.
Great, thanks. And you use the term arrest, and I heard that you then use the term stoppage. So is a growth arrest just another fancy term for the stoppage of growth in children?
Yeah, so that's correct.
Great. Thank you for explaining that, Dr. John. Very helpful.
Thank you, Mark.